Hi, everyone. My name is Jess Nicholas, and we're here with another dentist interview in our Roundtable series. Today, we're here with Dr. Taskonak, who is a prosthodontist in Fort Lauderdale, and Dr. McCawley, who is a periodontist in Fort Lauderdale as well. Our discussion today will be about the All-On-4, All-On-6 procedure, which is a dental implant procedure that's minimally invasive and can really restore the quality of life for patients. Our two guests are experts in the field, experts in this procedure, and we're very excited to hear what they have to say and how it can benefit you. So let's get started. Our first question is for Dr. Taskonak. Can you please briefly describe the All-On-4, All-On-6 procedure?
So, before I start describing the procedure, let me step back a little bit. I think the whole treatment the All-On-4, All-On-6 is taken out of the context, and it's kind of applied to each and every case like a boilerplate treatment. It is not. It is truly for patients who are terminal dentition, so which means that their teeth have no hope. They have to all come out. They have periodontals, they have excessive decay, and we can't save their teeth. That's the bottom line. Or they already have no teeth. They lost their teeth a long time ago, and they are wearing dentures. So, and they have good bone quality, which Dr. McCawley determines in the initial consult. Mm-hmm. The treatment is specifically for those patients. We get patients who come with healthy teeth or teeth that are treatable, and we let them know. We say, hey, your teeth are treatable, and we can fix your teeth. And also the natural teeth, like God-given teeth for each and every person is the best teeth. They might not like the way they look, mm-hmm. or they might not like, the shape of their teeth or other things. Those things can be fixed with other treatment methods. However, just like I said before, those, let's call it full mouth implant supported restorations are for patients who are terminal dentition. So let's go back to the initial question. The initial question was, can you give us a little bit of information about this treatment method, right? Mm-hmm. So the treatment method is basically replacing the missing teeth or the teeth that are about to be taken out with the implant-supported prosthesis. Just like you said, it increases the quality of life significantly. And the alternatives to that treatment, there are alternatives too to that specific treatment, is basically a complete denture. Complete denture is the oldest, fastest, simplest treatment method for complete edentulous. Complete edentulous is somebody who has no teeth. That's an edentulous patient, edentulous person. And, that complete dentures have been used for hundreds of years. George Washington had a pair of complete dentures. And I have patients actually who've been using dentures for a long time. And I offer them, we can improve the quality of life by giving you implants and giving you a fixed prosthesis. And they say, no, actually, I'm happy. I've been using this for such a long time and I'm used to it. So, and those patients, they're happy. And there's no point really going through a treatment with this extent. Mm-hmm. So I don't know if that answers your question.
Yeah, Dr. McCawley, if you want to take over, just kind of maybe a little bit more of the detail.
Kind of like, in a nutshell, what the All-On-4 and, later on we developed the All-On-6 here, the purpose is to replace the teeth with something that's fixed, that's solid. So, that's kind of the purpose here is to replace the teeth. And, you can replace one arch of teeth, or you can replace the other arch, or you can replace both if all the teeth have to come out. So that's kind of what it is. It's a fixed prosthesis, so it's not like a denture that comes in and out. It's something that's actually in there and it's solid. So it's something that's pretty darn close to a natural set of teeth as far as what we can provide here. So it's very comfortable for a lot of these patients. And so you can kind of think of the implants like the teeth roots, which the implants are actually what fixates it, what makes it solid, and the prosthesis is like the pearly white crowns of the teeth on top. So that's kind of what the All-On-4, All-On-6 procedure accomplishes is by replacing the teeth using implants and a prosthesis on top. So that's kind of what it is in a nutshell there.
So let me tag into what Mark said. I give this analogy to patients who come for initial consult. It's the quality of life that is important. And what we're doing is basically replacing a natural tooth structure or a natural part of the body. And so the prosthesis is it can be teeth or it can be any other part of the body. And I asked them, have you seen anybody with an artificial limb? It can be a leg, an arm, and they say, yes, of course I do. So the analogy that I give is that a person can get an artificial leg, which they can walk with a cane, or they can get an artificial leg prosthesis that they can walk without the aid of any other device. They can walk, or they can get another prosthesis where they can run, or they can get a prosthesis where they can play basketball, or they can run marathon. So what are you expecting from us? You want to run, you want to play basketball, or you're okay with just, being able to walk. Right. And most of the times the answer is, hey, I'd like to be able to do everything. I continue my life like I used to. I want to eat almonds, peanuts, or eat corn on the cob. If that's the case, then implant-supported prosthesis is the treatment to go. So it gives the function almost 99% of their natural teeth and the aesthetics as well. And it's very hygienic, it's cleanable. And we also, the difference that what we do with Dr. McCawley is we keep a good eye on our patients when they come to us, starting from the treatment planning all the way to the completion and the maintenance of the treatment. We always keep our patients close to us, close to our chest. And so if something goes wrong, we address it right there and then, and so that they can continue their life without having to think about their teeth.
Okay, Dr. McCawley, kind of to piggyback on that, how do you keep tabs on the patients? What's kind of the recovery around this procedure?
I mean, the recovery around the procedure, we definitely, we do follow up with these patients quite a bit better than pretty much anybody else out there, because we see them for their follow-ups, and we also keep seeing them repeatedly for, years and years here, because it's not just about putting implants into your bone. There's a lot of guys out there that can do that, but the real thing is, will these implants last for the lifetime of the patient? That's the real gold standard right there. And if you're just putting in implants and telling them, see you later, good luck, then you're really doing them a disservice here. You really need to follow up and be able to really monitor these implants, because implants can have issues. They a vast majority of the time they work fantastic, but you do see as the implants age, you can sometimes get bone loss, especially if you have gum disease, if you have a history of gum disease. And a lot of these patients, that's the reason they're losing these teeth. It's because they've got gum disease. The teeth end up, they lose bone around them, they get loose, and then we end up having to replace them with implants. And if you don't eliminate the infection, if you don't eliminate the bacteria that actually cause the teeth to fall out in the first place, you'll end up losing your implants as well, because a lot of the same bacteria that infects teeth infect implants. So you really need to follow these patients up. And we do that. We follow them up routinely, probably every 4 months or so after they get their implants and their prosthesis. So that way we clean them, we take x-rays, we check their bacterial load. So we can actually monitor these patients and figure out, hey, is this patient starting to break down? Do we need to do something to intervene to save these implants for the patient's lifetime? And that's really what we're able to do. And that's what a lot of guys don't do. And that's something you really need to look into and consider when you're looking at someone to do these types of procedures.
Yeah, the after part is just as important. Go ahead, Dr. Taskonak.
One other thing. So when the patients come to us for an initial consult, so this treatment, I think now the general public is well aware of the treatment method. And then they come asking us about this specific treatment. So once we determine that they're qualified, we take a series of records, which includes their CT scan, their intraoral scan, their pictures and everything. And Dr. McCawley and I will sit down and do a thorough planning. And everything is over-engineered, starting from the implant surgery to prosthetic design, material selection. And so we really want to make sure that these prostheses last as long as the patient lasts. So the trade name for the treatment method is All-On-4. But we don't really put 4 implants. Dr. McCawley prefers to put 6, and the worst case, we put 5 implants. And then the prostheses also, we don't like to put acrylic plastic prostheses. We like to put porcelain ceramic prostheses, and which the longevity is much better. It's much more cleanable. It's smaller. It's more aesthetic, and the function is much better. So I mean, the whole treatment is over-engineered towards the longevity and the function and the comfort of the patient.
Okay.
Yeah.
Dr. McCawley, why 6 instead of 4 or 5?
Well, I mean, the original treatment that came out, they were just trying to figure out, what's the least amount of implants we can put in to be able to replace a full arch of teeth, an upper or lower arch of teeth. And they came up with 4. If you angle them the right way, 4 is the minimum that you can get by with. But if something happens to one of those implants, maybe it doesn't go in solid, or if it fails later on, you end up with 3 implants, and you can't do anything with 3 implants there. You can't support a prosthesis. So it's always better to over-engineer these cases. And that's why, we try to place 5 and ideally 6. A vast majority of the cases, we place 6 implants here because, it's much, much stronger. That way you don't overload any one of these implants, because instead of placing 4 where, it's like a table, you've got 4 legs on it. But if you bite down too hard on one, you can possibly damage that. Whereas if you had 6, it distributes the forces a whole lot better, and you end up with something that's much more strong and something that's going to last you a lot longer time there. And that's really what we're after. We're after kind of the ideal treatment. That's what we're striving for here, is something that, we place the maximum amount of implants that we can fit in this area. And that way we can over-engineer the case to the point where it shouldn't fail. There's nothing that should cause this case to fail. So we want these cases to last, as long as the patient does. And that's really what we're striving for here with a modification of that older All-On-4 procedure.
Okay. So it's extra insurance basically to keep it there. Dr. Taskonak, you mentioned that you had a lot of qualifications for the procedure. Can you tell me some of those, as well as some things that would disqualify someone from the procedure?
So the number one factor that disqualifies the patient from not having the procedure is having healthy teeth, or teeth that are treatable. So when they come to us and they say, this is the treatment that I want because I saw it on the internet, I did my research, this is what I want. I don't want my teeth anymore. And we look at their teeth and we say, okay, what do you don't like about your teeth? They're treatable. And then we move from that point. We really don't want to take healthy teeth or teeth that are treatable. The second factor that disqualifies a patient, that they can have severe bone loss. Elderly patients who have been missing teeth such a long time, their bone tend to resorb over time. And so if they don't have bone quantity and quality to support the implant, we go through quite a bit of evaluations and imaging, x-rays to come to that point, and it rarely happens. And then there are methods where we can, graft the bone and augment the bone. Maybe Dr. McCawley can tell more about those. But it's very rare that somebody disqualifies because of the lack of the bone structure, but it happens.
Yeah. Mm-hmm.
Do you want to talk a little bit about that?
Yeah. I mean, every so often you'll see someone with, just a completely resorbed bone ridge where there's really not much you can do. I mean, I can kind of add a few other things that may disqualify someone. It's like uncontrolled medical issues, different types of bone cancers, things like that would just make the implants not work. And there's things out there that can happen, but a lot of those that can be modified. You can get the diabetes under control. You can control a lot of this stuff to make it where, maybe down the line we may be able to place the implants in the future, but we just have to fine tune a few things with the physician involved there. So that's definitely that's something that we can do. And I mean, it's kind of piggybacking on what Dr. Burak said. We do see some patients coming in that have been told, hey, you need this procedure. You need to have all your teeth out. You need to have, they say 4 implants, and you need to have this prosthesis put in there. And, it's a lot of, sometimes that's not the best option for them. They've been given a treatment plan that may be overkill for that specific patient there. There's, we're in the business to save teeth. That's our first goal, is to try to save the teeth. And, when someone comes in and say, hey, we have to have all these teeth taken out, I will evaluate those teeth and I'll tell them the truth. Hey, you know what? Maybe that's not the best option. Maybe we can save these teeth. We can do some periodontal treatment on them. We can get these teeth much firmer. And, Dr. Burak may be able to do a few crowns, veneers, things like that to make them look nicer. So, there's a lot of different options that we have. I mean, this is one tool in our toolbox, but it's not our only tool. And some places that is their only tool. I mean, if you look at some of the more corporate-y places out there, that's their one treatment plan. That's all they have. So, you really want to go to somebody who can tell you the truth. It's not just, if you've got a hammer, everything looks like a nail. So, you want to be able to go to someone who can actually treatment plan you as a patient, not treatment plan you as, an All-On-4. That's all they can do. So that's kind of just my 2 cents about it.
That makes sense. Dr. Taskonak, kind of speaking to Dr. McCawley, talking about different options. What are the differences or the pros of this procedure versus just like traditional dental implants? Or is there a difference?
So for individuals, let's step back and talk about individuals who are about to lose their teeth, like their teeth are hopeless and or they have no teeth. Their teeth were taken out a long time ago. So those individuals, there are 4 or 5 different treatment methods. So the number one is, just like I said, it's the simplest, fastest, easiest, cheapest method to treat edentulosum are complete dentures, which is not the best method. I mean, for the patient, more the complete dentures, they don't give the most comfort and the function to the patient, but it is a treatment method. So if we think of your natural teeth, You have all your natural teeth?
Mm-hmm.
Jess, you do?
I do.
So let's consider that 100%, right? So complete dentures are going to give you 20% of the function back.
Wow.
You won't be able to eat whatever you like. Your
Mhm.
speech will be impaired. The taste will be diminished because the roof of your mouth will be closed. And since they're removable, generally patients lose their confidence because they feel like there's something moving in their mouth and there's something artificial, synthetic in their mouth. And they don't like to, they get shy to go in public. So those are the consequences. There are pros. We were talking advantages and disadvantages, but it is an option. So the second option is now we can combine a denture with implants, where you can have a minimum amount of implants, and we can have something that is called an overdenture, which means that now you have support from the implants, and the prosthesis is not as loose in the patient's mouth as a complete denture. So now you have 50% of the function back. And with complete denture, if you can eat soft stuff, soft diet, now with an overdenture, you can bite into a sandwich. However, they're still removable. They tend to rock. Food gets underneath. You have to remove it, and you have to clean it after eating everything. So that's a disadvantage. But they're smaller than a complete denture. It doesn't cover the roof of the mouth, and however, they're removable. So the overdentures are removable. And again, there's a healing period involved with that. Implants, it takes some time to heal. It's bone healing, and those like implant removal prostheses, they're delicate. They're complex treatment methods, so it takes some time to complete the treatment. And in that period of time, in that transition time, patient uses complete dentures. Like think of complete dentures as a temporary transition towards an overdenture. And the third option is the All-On-4, which we don't like to do. All-On-4 is the third treatment option, where we don't prefer to provide the All-On-4 treatment because of the fact that there are a lot of risks involved with the All-On-4. So like Dr. McCawley said, if one implant fails, it's already a complex treatment method. Then the whole treatment needs to be done from scratch because, you lost an implant, you need to get an implant, and then the prosthesis has to be redone all over again. So we like to over-engineer. We like to put 6 implants. We like to do a ceramic prosthesis, where acrylic prosthesis, with 4 implants, you get an acrylic prosthesis, and they tend to break very easily. So from 20% of complete dentures function, we went to 50% with overdentures. With All-On-4, you go to about 70 to 80%. Because since it's acrylic, if you eat something hard, they might fracture, like catastrophic fracture. And then we do porcelain prosthesis. Now with porcelain prosthesis, you get about 95 to 99% of the function. The thing is, with porcelain, you might get chipping fractures. If you're grinding your teeth at night and, over time it chips off. Since we have an in-house laboratory, those patients, we can repair those prostheses in a very, very short period of time. And so that, they don't really get discomfort of going back to their temporaries or using something else or going without teeth. We can repair those prostheses. That's why we give a warranty to our patients. We keep them really close, and we keep a good eye on their oral maintenance, oral hygiene. And then if we observe anything with their prostheses, we can repair them and replace them in a very short period of time. We would like to see our patients every 4 months. and every 4 months they get their cleaning. Once a year we remove those prostheses. Only we can remove them. They cannot remove them. And then we observe the prostheses under the microscope and see if there's anything, any chips or anything else. We look at their implants, we take their x-rays. If there's anything, then, Dr. McCawley takes care of those. And, we want we want this treatment to last lifetime for the patient.
Okay.
Yeah,
Dr. McCawley, go ahead, sir.
Yeah, well, one of the big pros for this procedure over like the traditional implants that we were kind of comparing against here is, for a traditional implant, if you place it, you have to wait months for that to heal, because you can't immediately load it. You can't put the tooth on top of it immediately, or it'll wobble out because it's soft in the bone initially. But if you do this All-On-6 procedure, one of the main benefits is you can actually end up getting teeth within about a day. So it's a temporary set of teeth, but you still get teeth within a day. So it's fantastic to be able to do that, because when you place enough implants and you splint them all together, they're all super, super solid together. So that way, each individual implant may not be as strong as it would be in a few months after it's solidified into the bone. But if you splint 6 implants together, it is a very, very strong support base right there. So you can end up getting teeth about a day later. So that's a benefit for a lot of these patients, especially, if they're going from broken down dentition, broken down teeth, or teeth that are really loose, you're missing a bunch of teeth. So all of a sudden the next day you've got a full set of teeth here. That's a huge transition for a lot of these patients. And it's great to be able to do that for people, because, you can see it literally, you can see the confidence in their eyes spring back after you do these procedures for these patients. And it's great to be able to do that. And again, with these procedures, they get the temporaries within a day. And about 4 to 6 months later, we let the implants heal, we let the bone heal, we let the soft tissue heal, and then you get your final prosthesis, which, as Dr. Barak was talking about, it's actually made out of porcelain fused to metal. So it's a porcelain, it's a beautiful prosthesis. It's not the cheap plasticky acrylic that a lot of places do. This is the top of the line prosthesis here, and it's an absolute fantastic thing to be able to do for patients, and they really appreciate it and they really love it.
It sounds amazing. Dr. Taskonak, if you had a patient who was apprehensive about this procedure, what would you tell them?
So generally, they are apprehensive because they're scared. They are scared of dentists, period. And not only from the procedure. And when I tell them that the surgery is done by Dr. McCawley under sedation. So they are completely sedated while the procedure is done. So Dr. and it is IV sedation. So they will be really out. So the extractions will be done while they're sleeping, and implants will be placed while they are sedated. And I even come in and take the impressions from the implants while they're still sedated. So they wake up and everything is done, complete. The next day, we deliver their temporary prosthesis. And that doesn't involve any surgery at all. The surgery part is done. And everything that involves taking the teeth out, putting implants, everything, or grafting, bone grafting, everything is done by Dr. McCawley with sedation. And then the rest is prosthetic, which does not involve anything to do with the tissue.
Okay, so that's pretty easy for them, which is great.
I'd like to add one thing to the prosthesis. So the prosthesis is ceramic and with a frame underneath, and the frame is titanium frame. It gives us the benefit, it gives us strength, fracture resistance. Also, we can fabricate the prosthesis much thinner, so that the patients can clean it very easily. And also it's much more aesthetic too, compared to any other kind of prosthesis. There are acrylic prostheses as well as there's zirconia prostheses, but they tend to be thick and not as hygienic as the one that we fabricate. And then always question comes, how long is it going to last? And I tell them the goal is that the treatment lasts as long as you last, the patient lasts. And we even give warranty. So if anything happens to the prosthesis within 5 years, we replace it, repair it, no cost to the patient.
That's great.
Because we want longevity. That's our goal.
Exactly.
From beginning of the treatment, we want longevity for the patient.
Yeah, that's one thing that I definitely appreciate as a periodontist. I like these thinner porcelain or ceramic prostheses because the patient can actually clean around it. And again, a lot of the reason that these people are losing their teeth is because they had gum disease in the past. So you want to make darn sure that they can clean these prostheses. And, with the original All-On-4 procedure, they were doing these thick acrylic prostheses that were, they had to make them thick because the thicker it is, the stronger it is. And acrylic just isn't very strong. So we're able to do a much thinner, stronger prostheses. So you can make it thin so they can clean around it. They can clean underneath it. It's not this big bulky food trap that ends up getting food. And, we take off the prosthesis, 4 months later and you've got food from 4 months ago under there. That's not the case with these things. It's something that's very, very hygienic. It's about as hygienic as we could make these things. And it's absolutely fantastic to be able to help them out and give them something to clean because again, the last thing that we want is to have any issues with these implants. So you can see our whole treatment modality has been based around what is going to last the longest time in the patient's mouth. And with the All-On-4, you saw, there's issues with it. It's a weaker prosthesis. There's less implants. There's more fracture. It's more fracture prone. So we saw all the issues that they were having. And we're like, hey, how can we fix all of this? And that's what we did. So we placed more implants. We placed a better prostheses. And we're able to really engineer the case to last as long as physically possible. So because that's our goal, to last as long as the patient does.
And you mentioned gum disease as kind of like a cause of this. So what are a few things that people can do to prevent this from even happening? And you can both answer this, but we'll start with Dr. McCawley.
Yeah, I mean, with gum disease, it's kind of a silent thing because a lot of people don't know they have gum disease until it's too late, or their dentist tells them they need a deep cleaning or to go to a periodontist. So, it's not something that hurts. If it was a tooth that hurts, we'd have patients knocking down our door to come in, but the reason most people don't even know what a periodontist is because it doesn't hurt until it's too late. And then the teeth have to be extracted, or we have to do very, very significant surgery in order to try to hang on to some of these teeth. And, some of the signs and symptoms of this disease are bleeding gums. That's one of the main ones there. Loose teeth, bad breath, things like that really kind of trigger you that, hey, maybe something's not quite right. Maybe my teeth are shifting around somewhat. That may be gum disease, because what gum disease does is it actually destroys the bony support of the teeth. So as the teeth lose bone, they get more loose and they start to shift around a little bit more. Also, if your dentist has ever said, hey, go get a deep cleaning, odds are that's them telling you, hey, you have gum disease. So that's something that we like to prevent as periodontists before it gets bad enough where you need this kind of treatment where we have to remove teeth and place implants.
Dr. Taskonak, do you have anything to add about prevention?
Prevention of gum disease, I think Dr. McCawley did an excellent job.
Thank you so much. I appreciate it.
Gum disease is a result of bacterial activity in an individual's mouth, but it's not only gum disease, it's decay, caries as well. It's a bacterial activity. It's a result of a bacterial activity in someone's mouth. So early detection and prevention is the number one factor for that is going to a dentist. So if we go and see a dentist every 6 months, then we can identify those, we can diagnose, we can treatment plan, and then we can make a maintenance plan, periodic evaluation plan to prevent the disease to occur again. And also home care is an important factor too. It's not only going to dentist, but also paying attention to our oral hygiene at home. It comes back to, we try to save the teeth, and the All-On-6 treatment is replacing the teeth. But first, we try to save the teeth before we get to the All-On-6 treatment. And it's not the only treatment, only resort that we can have, and it's not a solution to each and every condition that we have in our mouth. So that's the last resort.
Gotcha. Okay. Dr. McCawley, do you have any final words to add for our audience on these procedures?
I mean, just, don't be afraid. Don't be afraid to come in. We can check you out. We can evaluate you as a patient. Again, not everybody's a candidate for this All-On-6 procedure here. It's we can evaluate you if you think you have gum disease. We can treat that. Honestly, we're the best in the world to treat that. And a lot of times we can save the teeth, because we see some people that have just they're afraid of going to the dentist, which is completely understandable, but it shouldn't stop you from coming in, because it's only going to get worse if you don't get it taken care of. And that's what we're here. We're here to help. And don't be afraid, because we've got IV sedation for these procedures too. So that's able to alleviate a lot of people's anxiety, and it's a lot of people that wouldn't otherwise be able to do any kind of procedures. We're able to take care of them, and that's really a great service we're able to provide for them.
Right. How about you, Dr. Taskonak? Any final messages?
So yes. Again, I urge everybody who's thinking about that to go get consultations, and we give complimentary consultations to our patients, which includes a cone beam CT scan. And in that consultation, we answer all their questions, and we evaluate their teeth, and we evaluate their bone structure. We take pictures and give them their pictures, and everything is complimentary. And we let them know. So maybe this treatment is not good for them. Maybe it's another treatment. They get the periodontal evaluation. They get their dental evaluation. And everything is given to them in writing as well. In addition to that, so probably the next question is going to be, what is the price? The treatment is not the cheapest treatment. All-On-6 is not the cheapest treatment. However, we have methods for them if that's what they really need, and if that's what they really want. We have our tools, financial tools for them, where they are affordable for everybody to receive the treatment. Again, it's a matter of them coming to our consult or picking up the phone and calling us. And I also urge them to go to our website. There are a lot of things in our website. They will be seeing patients who receive this treatment. We did we provided hundreds of treatments to hundreds of patients, happy patients who received this treatment. So they're going to see some testimonials on our website. And if they have any questions, please feel free to call. They can either call me or Dr. McCawley, and we'll be happy to answer their questions.
And I have one more thing to add, just as far as the pricing. I mean, we are priced very competitively. We managed to basically match the pricing of the people doing the old school All-On-4 procedure. and you get a whole lot more bang for your buck with us, because we're able to really just basically you get a Cadillac for the price of a Chevy. So that's what you get when you come to us. Whereas, over there, sometimes you don't get as much bang for your buck. So that's something that we're able to do, that Dr. Burak's able to do, because he's got that in-house lab. So we've been able to keep costs to a minimum here. So we're able to pass that cost savings on to you, the patient. So that's something that you're able to get while not compromising quality at all. You get the best implants, you get the best materials, best prosthesis. So you don't have to compromise quality, and you can still get the best possible option for you.
Great. Well, it sounds like an incredible procedure that really can truly change lives, like fully functioning teeth. You can do it with sedation. There's financial options available. So if you think you are a candidate for this procedure, or if you have any of the symptoms that the two dentists talked about in this discussion, don't hesitate to reach out to them if you are in the Fort Lauderdale area. We will have their websites and phone numbers in the description, so you guys can contact them if you are interested. I'd like to thank Dr. Taskonak and Dr. McCawley for their time and expertise. It was extremely interesting to me, and I hope you feel the same way. So thank you and have a great day.